So one of the most confusing, frustrating, and expensive, and also helpful aspects of Medicare is the Medicare Part D drug prescription plan. And today we are hoping to fix at least one of those aspects, maybe, hopefully, fingers crossed. Now this is Michael's Medicare, where we talk about all things Medicare, from plans to benefits to enrollment periods, extra help, prescription drug coverage, Medigap, and the whole kit and caboodle that is Medicare. But before we get to it, please don't forget to like and subscribe, because it does help our channel grow, but also because it'll help keep you up to date about the newest Medicare changes, the newest Medicare options, and ways to make more, better informed Medicare decisions. All right, here we go. So today, let's start off by talking about what is Medicare Part D coverage and why it even exists. First and foremost, Medicare Part D is an insurance coverage that is owned and operated and done through private health insurance companies. And some of these are companies that are behemoth carriers that we all know. And then there are also a fair amount of really kind of small indie carriers who just do Medicare Part D. But the point is that there is not a government plan. Yes, there is oversight by Medicare, but unlike Medicare Part A or Medicare Part B, it's not a government program. And it's not included in what is paid for when you and me and every red-blooded American gets a paycheck and gets their Medicare taxes deducted from it every pay period. Now that being said, Medicare Part D or PDP or Medicare drug plans, they go by a lot of names, are still very helpful as a program. And what they do is they really bring down the cost of medications for Medicareans, or folks who are on Medicare or Medicare beneficiaries. But it does it in a way that is sort of complicated and pretty convoluted. And of course, we'll get to that here in a sec. But overall, it is a great program that has saved literally millions of beneficiaries, literally billions of dollars. The reason they trade Medicare Part D is because prescription drugs, that is medications that you get a prescription from your doctor, and then you go to the pharmacy and then you pick them up, those were not included in any of the coverages under the original Medicare legislation. So neither Medicare Part A nor Medicare Part B are going to cover any of those drugs. And in most cases, there are some exceptions, but in general, they don't. Also, back in the 1960s or so, there wasn't nearly as many medications. They weren't keeping people alive as long, and they weren't so expensive, so it wasn't seen as a potentially crippling cost for the average older Americans like it has turned into today. To be eligible for Medicare Part D, somebody must have at least one element of original Medicare. So they could have Medicare Part A and Medicare Part B, or maybe just Medicare Part A or just Medicare Part B, but they have to have at least one element of original Medicare. Furthermore, on top of the cost for original Medicare, Medicare Part D plans also have a monthly cost that can vary pretty wildly depending on the plan. So what is Medicare Part D in a nutshell? Well, it is a private plan that covers prescription medications that are not covered under original Medicare. And of course, there is a monthly premium that has to be paid in addition to Medicare costs to be enrolled. And only somebody who has one forms of the Medicare, Part A or Part B or both, can get it. Woo! All right, so that's the complicated stuff. Let's get down to the easy stuff. So usually when we are talking to our clients about Medicare Part D, we break Medicare Part D in stages. They are stages because as somebody gets their medication prescriptions covered throughout the year, their spend on those medications will begin to accumulate. And for each drug that they buy, and as that spend goes up, that is what changes through the different stages of Medicare Part D. First stage is going to be what is called the deductible stage. That is when the Medicare beneficiary is going to be responsible for 100% of the cost of their medications. I mean, it is sort of similar to a deductible on a car insurance or a health insurance deductible. It's just that initial amount of money that someone is going to be responsible for to pay for their Medicare Part D drugs. In 2024, the deductible stage will max out, meaning that it ends at $545, meaning that once a beneficiary gets enough prescriptions to reach a cost of $545 in 2024, they are going to go outside that deductible stage. And cost-saving elements of Medicare Part D, that's when they start to kick in. Also important to mention is that the deductible max of $545 is a max. There are Part D plans that have low or even no deductibles. It's just gonna vary. So it doesn't mean that they have to have $545. That's simply the most that they can be. But it is not as simple as which company has the lowest deductible. That'd be an easy choice because there are other factors to consider like monthly premiums, the medications that are available and what those costs on those medications are. So once that $545 is reached and someone leaves the deductible stage, that is when folks move into the next stage, which is something called the initial coverage stage. And once the beneficiary is in this stage, the insurance plan will help pay for medication. This means that the beneficiary will either have a set cost per medication, or what is called a copay, or a set percentage of the coinsurance to pay when they get those medications. These costs or copays will be set based on the tier level that the medication is categorized in. So there's tier 1 medications that are preferred generic, there are tier 2 medications that are generic, tier 3 that are preferred brand, tier 4 that are non-preferred brand, and tier 5 which can be specialty, and I think there's even a tier 6 for kind of really exotic medications. So either way, as you move up that level, the cost per medication is also tending to go up. But as always, there are going to be exceptions to this. So the confusing part of all of this is that not every insurance company has the same medications at the same tier level. So they can move them around so that maybe the same medication with one plan, plan A, is tier 2, while that same medication on plan B is actually at a tier 3 and more expensive, and vice versa, which means those costs can change pretty dramatically depending on the plan. Or, for example, if the monthly premium is higher on one PDP plan, it may also be an indicator that some of those medication costs could be in a lower tier because you're paying the money monthly rather than paying it on the copays, so they appear less expensive, but all that's going to just depend on a personal situation. Now, to doubly make this process even more convoluted is the fact that the list of drugs that are available per plan, or what's called the formulary, doesn't have to be set. It's not a set list of medications that have to be included. So this means that each carrier can move around which drugs they cover for which illness. Of course, they have to have options for every available illness category, but they don't have to have every single drug for each of those illnesses. Now, as the beneficiary fills out their prescriptions and pays their copays, the costs continue to add up and continue to push through the initial coverage stage. Each time the prescription is filled, the beneficiary pays the copay. Let's say it's a $5 copay, and then the insurance company is going to pay the rest. The amount of that copay plus how much the insurance pays for that medication start to add together and start to build that yearly spend. So starting at $545 when they pass the deductible stage, up through a totality of $5,030 spent in total by the beneficiary and the insurance company. Once that $5,030 is hit is when the coverage will change into what is known as the not so delicious donut hole. So the donut hole is essentially a coverage gap. It is a period of spending in which the way medications are paid for are no longer copays, but are instead a flat percentage, in fact, a 25% of the cost for a drug that is paid by the Medicare beneficiary. Now, if we want to think about that just in terms of numbers, during the initial coverage stage, a drug that was $100 but had a $5 copay, now that beneficiary is going to pay 25% or $25 for that drug. So that is a pretty big step up in cost, especially for those folks who have numerous and expensive medications. Of course, this 25% cost is going to continue, and the beneficiary is going to continue to pay it throughout the year until the total cost for the year reaches $8,000. This $8,000 is made up of the costs that were paid during the deductible stage, the initial coverage stage, and the amount paid in the donut hole, and those discounts that were received on brand name drugs during the donut hole or the coverage gap. What doesn't count are the monthly premiums, the pharmacy dispensing fees, and what the plan pays during the donut hole stage. So once you hit that $8,000 yearly spend limit, that is when you reach drug nirvana, or what is called the catastrophic stage, which means that beneficiaries start to pay $0 for covered Medicare Part D drugs. So that makes it easy, but also keep in mind this is a yearly progression. It means that on January 1st, when January 1st comes around, it starts all over again. And whatever the new cost for the next year is, and just a hint, it almost always goes up, it's gonna have to be started over and paid again. So that is the general progression of Medicare Part D plans. There is so much more to all of this, and much more nuance to all of this. And we're gonna continue to make videos down to the very nitty-gritty for these types of plans, and really all the Medicare plans, because there are a lot of things that go into choosing the right plan. But that is gonna be it for today. And of course, if you have any additional questions or wanna get more information about your specific situation, feel free to reach out to us at the info below, or comment, or give us a call, or check out our other great content on the socials on YouTube and Instagram. So for My Goals Medicare, I'm Michael, hoping that you have a great rest of your day, and